Dr. Jake, how's it going today?
Hi, good. How are you?
Nice to meet you.
Take a seat.
Thank you. Appreciate it. How are you doing today?
I'm well. How are you?
I'm very well.
Just got a lot of patients to see.
Do you?
Oh my gosh, yes.
Gotcha. Well, is it okay if I take 15 minutes of your time?
Yeah, that's what we scheduled for. So, I mean, in 20 minutes I have to see someone. So if we can do 15, like, that's fine. That'll work.
Great. Well, I want to start out by just leaving you with my business card.
Okay.
It's got all my contact information on there in case you ever need to reach me or anything like that. So that should be good. But I have recently heard that you have been practicing for 20 years. Congratulations.
Oh, thank you.
How's it been?
It's good. Some days it feels like I've been doing it for 100 years, to be honest. And then other days it's like I just started. I mean, your passion's there. I'm sure you know that.
Definitely.
But, yeah, I love it.
That's great. I'm happy for you. I hope you get another 20 years of success.
I would like to retire one day, but yes.
Right. Oops. Okay, so I don't want to take up a lot of your time like we recently talked about on the phone about Treximet, but I just wanted to give you kind of some knowledge about the product and just let you know more about it, answer any questions or concerns that you have.
Okay.
And I just want to set a little agenda first so we can make sure that we cover everything that we really want to. I want to tell you more about my company, or the company that I'm at, GlaxoSmithKline, and then Treximet itself, the pros and cons of it, the side effects, and then some of the reviews that we have from previous patients that have used it from the past year, and then any other questions or concerns that you might have.
Well, I know GlaxoSmithKline, well-respected brand. We use some of your other drugs, but Treximet, I haven't heard of that one.
You haven't? Okay.
No.
Okay, cool. Well, hey.
I mean, I haven't heard a lot of it, is what I should say. Because last night, I know we had this meeting, so I was trying to look up information, and honestly, there's not a lot out there.
There is. I mean, it is more of a newer drug.
Correct.
So I wouldn't expect to find too much. But in your research of what you did find, what was like the greatest need that you saw in it that your patients would need?
Well, I'll let you know right now, 25% of my patients, because Treximet, they said it was a migraine drug, correct?
Correct.
25% of my patients suffer from migraines.
Okay.
And it's me and 5 other doctors below, because it's a family practice, and so 25%, and of those, we currently prescribe Imitrex.
Okay.
And the thing is that takes 4 to 6 hours to start. So my main concern is this quicker? And I just heard that Treximet is quicker, but I don't. They didn't say about how much.
Right.
They didn't say, and I'm like, well, I can't, really aggregate any information from that. There's no specifics.
Correct.
No actual quantitative data.
Okay. Yeah. Well, I'm definitely here to help you answer those questions and take care of all your concerns that you have. So you said you had 25% suffer from migraines, and your patients are very important to you.
Oh my gosh, yes.
Yeah. Okay. That's definitely something that we care about a lot too, because we want our patients to have the best, have the longest living life, that they can. Now, what medications are you prescribing now?
Mostly Imitrex, and then let's see. Then just some other one that I'm kind of discontinuing because it's only like 15% of the migraine sufferers use that, and it's not the best effects. But basically Imitrex. Okay. Like I said, it's 4 to 6 hours to take effect. Not a lot of side effects, which I like, but a lot of my patients are really busy family, career people, and then like their kids that go to my practice as well are like college students.
Okay.
And, nobody has time to wait around for things to take effect.
4 to 6
They're
hours.
like, it does work, doctor, but like, what can you do to make it quicker? I'm like, well, this is what has the least side effects, because I care about their long term. They don't always see that when they're thinking, I just want something to make me feel better. You have to guide them like long down the road what's going to be best for you.
Definitely, I totally agree. And like you said, with the 4 to 6 hours, I don't suffer from migraines.
Right.
But if I did, or even have any headache, waiting 4 to 6 hours once you've taken something for relief, I mean, that seems like a pretty long time for me, to wait around for something like that.
Kind of does.
Right.
I feel bad for any ailment they have if they have to wait around. So.
Exactly. Right. Okay. So what if I told you that Treximet has about 30 to 40 minute relief from the time that you take it?
I would be really interested, but I would also be like concerned, how are you getting something that great,
Right.
Because that's great, 4 to 6 hours to like 30 to 40 minutes. That's like miraculous, but it also raises like, why is it so good?
Right, definitely. Well, let me share a little bit about our company and about Treximet itself, just so you can kind of maybe put some things together to see kind of why it is like this, and then I can further tell you once
Yeah,
I explain
go
those
ahead.
things. Okay, so GlaxoSmithKline, like I said, we are a science-led global healthcare company that has a mission that we want to help people to do better, feel better, and live longer.
Right.
So the vaccines, medicines, consumer healthcare products that we research and develop, we do that to help people, their well-being, and ultimately help them to live a life like the fullest that they can and prosper in their communities. And I know you said your patients are very important to you, and that's something that's very important to us too. We want them to be able to live good lives in their community and live a long life to the best of their well-being and not feel sick like in the time.
That's what I try and do every day.
Yeah,
So,
definitely.
yeah.
So I also want to tell you that we have 99,000 employees
It's a lot.
in 115 countries. So we're basically known worldwide. We are known as for a lot of different drugs, but Treximet is something newer that we are currently prescribing to different people. So let me tell you a little bit about Treximet now.
Yeah, that's what I'm really
that's what you're here
interested
for.
in.
So let's get into that.
That's-
Okay, so Treximet is really two different things in one.
Okay.
So
Yeah.
it's sumatriptan and naproxen. So sumatriptan is a headache medicine. It's believed to work by narrowing like the blood vessels around the brain.
Okay.
So kind of getting some relief off that. And then naproxen is an anti-steroidal, anti-inflammatory drug. I'm sorry. And what that does is naproxen works by reducing hormones that cause inflammation in the body and takes away the pain in it. So it's two things in one. So it takes away the pain. The naproxen does with the anti-inflammatory, but then the sumatriptan helps with the blood vessels around the brain to release some relief. Okay. So it treats headaches, but it doesn't. It's not something that prevents them.
Oh yeah.
Which is pretty
chronic
obvious.
migraine
Right.
sufferers.
Definitely. So based on what I shared with you about like our practice, kind of what we do, does that seem like something that your patients could be interested in?
I'll tell you up front, 30 to 40 minutes is great, and a lot of people would be willing to have it. But my concern is, like I said, I care about them long term, is side effects, because it's a relatively new drug, and what I'm using right now doesn't really have that many side effects. I mean, maybe a little drowsy or dizzy sometimes, but I mean, that could be from a number of things, you know. And I really would hate to introduce something and get everyone hyped up just to find out down the road, like, oh, yeah, look at these side effects. And I couldn't even find the side effects list online. So, yeah, I'm a little concerned about that.
Yeah.
But I do like that 30 to 40 minutes.
Definitely.
Almost everyone that suffers from migraines in my practice would be interested in that.
Okay, very cool. So what we'll do is I'll kind of transition to the pros and cons of Treximet and talk about the side effects.
Most definitely, let's do it.
Okay, so what we have, I have a sheet of reviews here.
Okay.
This is kind of the reviews of patients that we've had for about a year, because Treximet is still new. It's still a new drug. We don't have anything past a year.
But they've been trying. These people from this review an entire year, like.
Entire year, like they could get migraines a couple a month and they'll take it, or as much as they need. They're taking this for a full year of any migraines that they
Well, I'm
have.
seeing mostly hundreds and a few 90s. Not really anything bad. But my question is, what are the most complaints like keeping everyone from like giving perfect scores?
Right. So what we have about 80% of people give it like 100%.
Right.
Because of its ease of use, its satisfaction, and its effectiveness.
Yeah.
So really, it's all around for what we've been seeing so far has been great. The cons that we're seeing here are the price.
Yeah.
Now the price is what people are complaining about, but a little bit here and there. But they're still willing to buy it because of how effective it is.
Right.
So the price is there, and it's kind of double of Imitrex of what you're currently prescribing.
Kind of double, or it really is
It's double. I mean, it is double,
Okay.
I'm not going to lie. But it really has two things in one, like I was saying. It has the sumatriptan, which Imitrex has, but it doesn't have the naproxen. I mean, Imitrex doesn't have the naproxen, but Treximet does. So that's kind of where the price comes in, and its effectiveness, and it's how easy it is to use in the 30 to 40 minute window.
And I understand that as drugs, become staples, at practices. Like, I understand prices usually go down. It's just, I'm looking, because at my practice, if I want to ever introduce a new drug, most people are insured at my practice. We have very few people that are just cash or like, but my issue is, this is covered by a lot of insurances because it's so new.
Okay, so it is new, and I know of a couple insurance is that cover it,
Yeah.
and that's Blue Cross Blue Shield is the big one that most people are usually
Yeah.
have as their insurance. They do cover it.
Like 100%, or just what the usual would be for eye insurance?
It would be they do cover about 100%. I mean, pretty usual. It might be a little more than Imitrex,
Okay.
but not double at all.
Well, if they're not paying the double, then okay.
This is just without the insurance, it would be double.
Okay.
But we are seeing people, like I said, that are seeing that it is still worth it for paying double just for what it does.
Okay.
But I also wanted to say another pro of Treximet would be that it's non-steroid, which is kind of something big nowadays. That how bad of a rep steroids is getting, they don't really want it in there unless it needs to be. So this is a pro.
Let me tell you, how many wives come in with their husbands when I want to prescribe something and it has just steroid mentioned, and they go on Google and they think they know everything.
Right.
They do not. And then I have to spend like 15 minutes trying to explain to them that no, like the steroid isn't in the same dose as, AJ Krasinski or like some sports guy that they assume does steroids. So that would save me time. I can actually get to more patients instead of explaining, just since it's not there, I wouldn't have to go through that whole ordeal. Just say it's not there.
Right, and nobody wants those wives to be coming in and talking like that to you.
It's the husbands sometimes too. They don't want their wife turning out like their brother,
I totally understand that. Now, what I wanted to say about the side effects, because I know that's a big thing for you. Now, Treximet isn't going to have more side effects than what you're previously prescribing Imitrex.
It won't have more?
It'll have about the same.
So
it's not going to have any less, but not any more. It's going to be about the same. And the main ones are flushing in the face, tingling, numbness, nausea, tiredness, weakness, dizziness.
Okay, so not like blood clots or anything like that?
No, nothing like that. Just kind of the basics. And it's that's something that kind of comes along with all of these migraine relief drugs.
I really like that it's not any more side effects, because that's like always my biggest thing when people approach me with new drugs, and I usually turn people away because they'll say, yeah, it's faster and it has a better treatment rate, but then the side effects are like, is it the benefit worth it, because you're going to have something else?
Exactly, and I totally
But I like what you're saying, that it's less side effects, or it's the same side effects,
same.
And then less time. It's more effective for that.
Definitely. So. Okay, cool. Now, what I wanted to ask you then, did you have any other questions or concerns that you're really, kind of wondering about, or that I can answer here?
Well, I've never dealt with you before. I know GlaxoSmithKline, and I've used them for other things. And I've pretty much had good experience, but lately there's been some reps with like Roche Pharmaceuticals and Merck/Sandoz. And what I don't like is I'll have a question, or a patient will have a question. I'm trying to facilitate that conversation, and they take forever to get back to me.
Right.
And like I said, okay, you said 20 years of experience, but if I wasn't on it, I wouldn't be having that. So are you on it like that?
Yeah, we are definitely committed to being there for our customers and making sure that if they have questions that need to be answered, I'm going to be there for you. And if I'm not there, I'll have someone else.
Is that what that other number's for?
That's my other number that you can contact me basically anytime. I mean, I am a sales rep, so I really do not.
But the one right here, is that like for the other person if you're not?
Yes.
Okay.
If I'm not there, that's who you can contact, and if I don't answer that number, you can call the other number.
Okay.
On there.
That's good, because that's the kind of standard we have here.
Yeah, definitely. Okay, so after everything that I've kind of covered with Treximet, does that sound like something that you would like to maybe try out on your different patients that you have?
Well, when I look at 25% having migraines, the biggest complaint, like I said, they're busy professionals, is it takes too long. 4 to 6 hours is like, it's effective, but so if you can give 30 to 40 minutes and it's covered by insurance, pretty much the same, I think I would be, because it's the side effects. If you would have told me more side effects, I probably would have been not at this time. But you know what? How about I'll take some of your samples, and then how about 2 weeks you come back?
Yeah, that's great. Well, I have some samples here, about 24, that you can give out to your patients, get their feedback, and then let's meet up in 2 weeks.
But I would like you to give me like something to give my patients to make them more interested in.
Okay, well, we do have.
What can you do?
We do. I know the price is high, so we have these coupons, and they're about $50 off your first purchase as a patient. So your patients can use this. If they do like the trial that they are using, they can use this $50 off on their first purchase.
Well, could you actually do, because you said it's double the price, and if it's currently like $300 for the, That was back when it first came out. I apologize. It's like 100 now. Could you give me 100 off?
For this one time, I think I could do that for you.
Okay. Then yeah, just come back with these. You can like send me. And then yeah, I'll meet you in 2 weeks.
All right, sounds great. Thank you so much for your time.
Sweet.